from Johannesburg in South Africa. Médecins Sans Frontières says health workers in the Democratic Republic of Congo are struggling to contain the current Ebola outbreak. The International Medical Organization has called for an urgent scale-up of the response as the Ebola outbreak becomes the fastest growing on record. The latest figures show that more than 1,000 people have died in the 2 months since it was declared a public health emergency of international concern by the World Health Organization. For more on this, Trish Newport, MSF's Emergency and Medical Coordinator for the Ebola response in Bunia, joins us on the line. Trish, good afternoon and thank you for joining us on Africa Update.
Thanks for having me.
Trish, what is the current situation in the DRC in terms of just the response to the Ebola outbreak?
So the current situation is so concerning. Every day we see new cases and we see new cases in areas where there haven't been cases before. We also see people still arriving to Ebola treatment centers very late and people continuing to die in the community of Ebola. What's concerning about this? Because as soon as someone is symptomatic with Ebola, they are infectious. And we need to be able to isolate them right away to be able to stop them from being infectious to other people. As long as people are still in the community when they develop Ebola symptoms, and as long as people are still dying in the community, the number of cases is only going to increase because the disease will be transmitted to other people. One big challenge we see today is the cases are spreading. Ebola is spreading to new areas, and we're just not able, as an overall response, able to catch up to the spread and the size of this disease. So we see in the capital city of Ituri in Bunia, there's not even that there's a big response, but it's not big enough. And outside of Bunia, they're definitely not able to respond as fast as the outbreak is spreading. It's extremely, extremely concerning.
Now, just looking at that, Ituri province accounts for nearly 90% of cases, but Ebola has been confirmed in 5 provinces, all in the east of the country. How are rural areas coping with the outbreak, and what are the challenges where people? What are the reasons why people are not coming forward, especially with the fact that there have been cases of Ebola in the past and that were dealt with quite quickly.
So there have been, this is the 17th Ebola outbreak in the Democratic Republic of the Congo. The Ministry of Health has a lot of experience in responding to the outbreak. They're leading the response, but there's just not enough international support to be able to respond in every single area. Of course, where that's spreading right now in Owele, in Chopo, these are provinces where access can be very difficult, where the roads are very small, where it takes time to get to these areas. Ebola isn't something that you can quickly respond to if you don't have all the supplies, if you don't have training, if you don't have experience. So in more remote and rural areas, if there's not a response with the Ministry of Health and with international actors, to be able to train healthcare workers, to be able to provide all the supplies to protect them, healthcare workers are also at risk of developing the disease. And we know that if health centers and hospitals don't have the training to do proper triage, to have the material to actually screen people, there's the risk of it becoming super spreader events in healthcare structures, and that becomes even more dangerous. So you really need to have all of the pillars of outbreak response in place in every single place where there are Ebola cases. And this, at this moment, with the resources that are on the ground, it's not possible.
Now, as MSF, you're calling for urgent scale up of the response as the Ebola outbreak becomes the fastest growing on record. What exactly is needed to address this? Why is the international community not responding effectively?
I mean, there's many things that are needed right now. First, there needs to be more international resources on the ground to be working with the Ministry of Health to respond to this Ebola outbreak. Today, it's just not enough. And as I said, there's just not enough resources to be able to respond every single place where there's Ebola cases. We're not even able to do preventive work in places where there's not Ebola cases because we're just running behind the outbreak, trying to catch up to it. Of course, we know it's the Bundibugyo virus. It's only the third time in history that there's an outbreak of Bundibugyo virus. And so because of this, there's no treatment today. There's no vaccine. And so we also need the international community to be working on speeding up research and development for treatments and for vaccines.
Trish, thank you so much for joining us on Africa Update. We'll leave it there for today. MSF's emergency and medical coordinator for the Ebola response in Bunia, joining us on the line. It is 12:47 Central African time, and we're coming to you live from Johannesburg in South Africa.
A legacy isn't a statue or